Hey everyone, welcome back to the channel. Today, I'm diving into something every medical student should know about: avulsion and luxation injuries. These terms might sound intimidating, but by the end of this video, you'll have a solid grasp on what they are and how to manage them. First up, let's tackle avulsion injuries. Simply put, an avulsion injury occurs when a fragment of bone is torn away by a tendon or ligament. It's like pulling a string too hard and snapping off a piece of whatever it's attached to. You'll often see these injuries in high-stress activities like sports. Common sites, think fingers and ankles. Now, how do you identify an avulsion injury? Look for pain, swelling, and sometimes even a visible gap where the bone fragment used to be. X-rays are your best friend here. They can help you confirm the diagnosis and plan your next steps. Treatment usually varies based on the severity. For minor avulsions, rest, ice, compression, and elevation, yes, RICE, might do the trick. But more severe cases could require surgical intervention to reattach the bone fragment. All right, shifting gears to luxation injuries. A luxation, or dislocation, happens when the bones in a joint are forced out of their normal position. This is a common sports injury too, and it can be quite painful. Shoulders, elbows, and fingers are frequent culprits. Spotting a luxation is usually straightforward. The joint will look visibly out of place, and the patient will likely report intense pain and inability to move the joint. You might also see swelling and bruising. Again, X-rays are crucial to confirm the dislocation and check for any accompanying fractures. Treatment starts with reduction, which is the process of moving the bones back into their correct position. This should be done by a professional to avoid further injury. After reduction, immobilization using a splint or sling is common to allow the joint to heal. Physical therapy often follows to restore full function. So, what's the take-home message here? Whether it's an avulsion or a luxation, early diagnosis and appropriate treatment are key to ensuring proper recovery. Keep an eye out for the signs, use your diagnostic tools, and don't hesitate to consult with specialists when needed. And that's a wrap for today's quick overview. If you found this video helpful, make sure to like, subscribe, and hit the bell icon for more medical insights. Stay curious, stay informed, and I'll see you in the next video. Take care.